Today we will be discussing about glucose infusion rate. We will focus and try to keep our concepts very crisp and clear for daily application. So I want to start by reading this paragraph in AIMS protocol given in a section of hypoglycemia management. So in case of symptomatic hypoglycemia, all infants should be treated with IV fluids and a 2 ml per kg bolus of 10% dextrose should be given for symptomatic hypoglycemia. The bolus should be followed by continuous glucose infusion at 6 to 8 mg per kg per minute. Blood glucose level should be checked after 30 minutes and then every 6 hours until blood sugar is more than 50. If it stays less than 50, despite bolus and glucose infusion rate GIR should be increased in step of 2 mg per kg per minute every 15 to 30 minutes until a maximum of 12 mg per kg per minute. So coming to what is glucose infusion, what is GIR? Glucose infusion rate. It is the amount of glucose that has been delivered per kg of body weight in a amount of time, which is per minute. So what will be the unit? Mg per kg per minute. Okay, now we understood this, but how do we calculate GIR? There are three basic formulas. GIR is percent of dextrose into ml per hour, that is rate, by body weight into 6, or in ml per kg per day into percentage of dextrose by 144, or fluid rate, that is ml per kg per day into 0.007 into percentage of dextrose. Here basically last two formulas are same because 1 by 144 is nothing but 0.007. And how did we get 144 in the first place is that mg per kg per minute, right? And now we have ml per kg per day into percent dextrose by 144. No? This kg we have converted into milligrams and this day we have converted into minutes. So by doing the calculation, by doing the math, we will get. Now let us do one small exercise to understand this calculation. This is a day 2 late preterm neonate who is weighing 2.4 kgs with PFI of 80 ml per kg per day and ongoing 10% dextrose. How do we calculate the GIR? So it's pretty simple. We have GIR is equals to percent dextrose into TFI in ml per kg per day by 144, right? So we have 10% dextrose into 80 ml per kg per day by 144, which is nothing but 5.5. So here GIR is 5.5. Now anything to do with weight? No, because already we have how much ml per kg per day is given, right? Now let us see in other formula, how can we put it in other formula? So another formula for GIR is what? Percent dextrose into rate in ml per hour by body weight in kgs into 6, right? So percent dextrose is 10 and how much ml per hour is going on? So we know that it is 80 ml per kg per day. So 80 into 2.4, that is 192 by 24, which is nothing but 8 ml per hour is going on by how much is the body weight? 2.4 into 6. So now we have 80 divided by 6 into 2.4, that is 144, which is again the same thing, 5.5. Now I tell there is a day 2 baby who is a late preterm with weight of 2.4 kgs and rate of fluid as told by sister, because she doesn't know how much TFI baby is on, and she comes to you and she tells you that I don't know what is a TFI exactly, but now the child is on 10% dextrose and rate is 6.6 ml per hour. So you know it is 6.6 ml per hour, weight is 2.4 kgs and percent dextrose is 10% dextrose. So if you have to calculate GIR, it is again simple. Percent dextrose into rate, we have it directly ml per hour by body weight into 6, that is what we will do. So what we will get? 66 divided by 14.4, which is nothing but 4.5. Now if I tell you that there is a 5 days old term neonate with weight of 3 kgs and this child has issue of hypoglycemia. Now TFI is 100 ml per kg per day and using 15%, already on 15% dextrose. Now how do we calculate GIR for this child? Simple hai, 15 into 100 divided by 144, which is nothing but 10.4, right? So it is again simple. Next, this is a day 2 term neonate weighing 3 kgs with hypoglycemia. Now on TFI is 100 and GIR is 10. After 15 minutes, you see RBS is 48 and your senior will advise you to increase GIR to 12. Then how do you do that? We require 144 into GIR 12 by TFI we will keep same, which is nothing but 17% dextrose approximately. Now our question is how to get to 17% of dextrose. So how do we calculate and how do we mix dextrose fluids so that to get to 17%? Now we have 5%, we have 10%, we have 25%. Common sense tells us that we have to mix something of 10% and something of 25% to get 17%, right? So how do we do that? We have two methods. First method is that you have to take maximum available concentration of dextrose, that is 25, minus what is required, that is 17, divided by 25, which is maximum, minus minimum concentration of fluid, that is 10, which is how much? 8 divided by 15. So this many parts of 10% dextrose is to be given. Now suppose you have to make 100 ml of fluid. Then how you will do? Into 100, which is equals to 800 divided by 15. 53 ml of 10% dextrose you have to give. Then how much ml of 25% dextrose you will give? Which is nothing but 100 ml minus 53 ml. 47 ml, right? Other way is we want 17% dextrose, right? Now what we have is 25 and 10. So we will subtract 25 and 17, which will be 8. 8 parts of 10% dextrose is to be given. Remember that. Next, we have 10 and 17. So it is 7. So 7 parts of 25% dextrose is to be given. That is 7 by 15, which is nothing but 7 plus 8. Into how much fluid do you want to make? 100 ml, right? 100 ml. So how much it will be? 700 divided by 15. Nothing but 46 ml around. 46.5. Now I want 10% dextrose. Now that is of 25% dextrose. Now 8 by 15 into 100 is again 800 divided by 15, which is equals to 53. 3.3 ml around, you can do it like 53.5 ml. And this will be around 46.5 ml, right? Now we will get 100. Coming back to our initial concept. Now we understand what is continuous glucose infusion at 6 to 8 mg per kg per minute and what is the meaning of increasing GIR by 2, how to calculate GIR and identify the maximum of 12. Now we understand these concepts. Here we further discuss some important points that you should know about GIR. What is a normal GIR? How should we maintain it? How should we initiate it? So it is usually 4 to 6 in terms and 6 to 8 in preterms. So when is the requirement of GIR increased? So we can know that in case of prematurity, as I have discussed in preterm, we start from 6, right? Other, if baby is in any acute stress conditions, infant of diabetes mother, polycythemia, birth asphyxia, these conditions demand high GIR. When do you suspect hyperinsulinemia? Hyperinsulinemia is the most common condition of persistent hypoglycemia. So it is a line quoted from Ames protocol again that recurrent or resistant hypoglycemia is when infant fails to maintain normal blood glucose despite a GIR of 12 or when stabilization is not achieved by 7 days of therapy. And it has also been mentioned that hyperinsulinemia must be excluded because it is the most common cause of persistent hypoglycemia. So how to titrate GIR, that we have learned, we have to increase or decrease by 2, and first we will alter percentage dextrose and then we will change TFI. How much of glucose percent can be given in peripheral and central lines? So peripheral line maximum is 12.5% to avoid the risk of thrombophlebitis extravasation. And central we can give maximum, that is 25%. And what are the caution that should be kept in mind and what do you monitor for? First, in IUGR or SGA babies, there is a risk of overshooting. Means if you give high GIR in a low period of time, then there is a problem of hyperglycemia that we should be careful of. Lastly, let us sum up our concepts by one scenario, right? So this is a 5-day-old preterm baby. Weight is 1.5 kgs and is on TPN. And TFI, they have given 100 ml per kg per day. Medications child is receiving around 10 ml per day. Sodium and potassium is added to the fluid, that is 2 and 1 milliequivalent per kg per day. Calcium at 4 ml per kg per day as a prophylactic measure. Amino acids and lipid at 3 and 2 gram per kg per day respectively. Now, how do we calculate GIR? First question. So let us go to our basic concepts again. So we know that GIR is equals to percent dextrose into total fluid intake by 144. It is very simple. So, but thing is that here how much total fluid intake will you consider? 100 or something else? So since the child is on TPN, so first we have to exclude remaining things that are going on, right? So what are going on? Medications, which is 10 ml. Then sodium is going on at 2 milliequivalents per kg per day. For details of TPN, let us discuss that in another class. For now, it is 2 milliequivalents per kg. So 2 into 1.5 into 2 we'll do. Plus potassium, how much is going on? 1 milliequivalent per kg. Next, calcium is 4 ml per kg. And amino acid being 3 gram per kg per day. And lipids being 2 gram per kg per day. So this becomes 82.75, consider 83 ml, right? So this we have to subtract from TFI, which is how much? TFI is given 100 ml per kg per day, which is nothing but 150 ml per day. Now our fluid, glucose containing fluid, will be 150 minus 83, which is how much? 67 ml per day, 44.5 ml per kg per day. Now we have got our final TFI, right? So let's put in the formula and complete the question. Percent dextrose, which is 10% dextrose that has been going on, into TFI by 144, right? It's nothing but 3. So GIR of 3, is it okay or not? GIR of 3, is it okay or not? So we have discussed that child has to be on GIR of more than 4. This is considerable if the child is on oral feeds, but child is on TPN, likely NPO, so this is not enough. So we have checked RBS. RBS is 45 and child is asymptomatic. What do you do next? Next, we have to increase GIR. How much will we increase? You guys tell me, how much will we increase? By 2. So GIR, we have to keep it 5. Minimum. 5 we will keep. So what is the percentage of dextrose? Percentage of dextrose will be 144 into GIR by, how much is the TFI? 44.5. So 144 into 5 divided by 44.5, which is 16. 16% you need. So how do you make 16% dextrose? Again, how do you make 16% dextrose? We will do this simple formula. We need 16, we have 25, we have 10. So we get 6 here and we get 9 here. So this is nothing but 6 by 15 into how much fluid we want to prepare. We want to prepare 100. Here I am telling you we want to prepare 100. So into 100 we will do. That is 40 ml of 25% dextrose is to be mixed with 60 ml of 10% dextrose. So this is all you need to know about GIR, how to manage a child with the hypoglycemia, how to titrate GIR, how to monitor GIR. So this is all about it. If you have any doubts, please put in comment section so that we can discuss. Thank you.